So with COVID-19, it's absolutely critical that we wear masks and social distance and don't give mixed messages. That's going to be the answer. And that when we do open up, we open up gradually. I think we're in a very critical part where the schools are opening and the colleges are opening. For lower school, for grades 1 through 4 or 5, they have a lower rate of infection. If they do get infected, it's not as severe. But high school students actually are more likely to infect their close contacts than adults. High school students think they're invincible, so I'm very concerned about the high schools and even more concerned about the colleges. And this issue about, when I have 1,000 cases at the college and I've filled the quarantine dorm, do I close the school and send them home for a few weeks, or do I keep them there? Very, very difficult questions, and I'm not sure there's a correct answer. We have a vaccine that's coming up. We have over 100 candidates. We have a number that are in phase 3 trials. 2 of the vaccines that look the most promising were the Moderna vaccine, which is with NIH, and then the Oxford vaccine. And they're both in phase 3 trials now, trying to enroll 30,000 people, but they're 2-shot vaccines. One is baseline and 21 days later, one is the first shot and then 28 days later. So it's going to be a long time to enroll these 30,000 people. And what I'm afraid of is there's going to be so much pressure to get a vaccine out early before it's proven to be efficacious or safe. And we just saw that the Oxford vaccine, one of the patients developed transverse myelitis. Now, whether that's related to the vaccine or not, we don't know, but all of a sudden that trial has been put temporarily on hold. We really need an effective vaccine that we believe in, that we trust. And if we come out too quickly before we have good data, it won't do any good to have a vaccine that people won't accept. So I think, frankly, this is going to be around for a long time. I think it's going to become what we call endemic. In other words, where we see it every year. We have 4 other coronaviruses that cause about 20% of the common cold. And every winter, these coronaviruses come back, they cause the common cold, and then as it warms up, they disappear to come back for another season. And the immunity is short. It's only about 6 months for these, and that's why it comes back every year. So will this one become endemic? Will it mutate so that it's not as harmful? This virus doesn't want to kill people. It wants to have people stay alive so it can reproduce more. So it may just become milder over time and then become endemic. But this is not the type of thing where you can just wave your magic wand and say, I want to go back to school, I want my businesses to open, and it's going to happen. This virus is going to go its own way, and we really need to be cautious. But one thing I think we've seen is we don't need to completely shut down. If people wear masks and social distance, we can open many things that were closed back in March, and I think successfully do that. I think bars are going to be the most difficult. You've got a closed space, you've got close contact, and you've got crowding. And those are the 3 C's of transmission of COVID-19. So that's, I think, going to be dangerous. There was just an article out that showed an economic analysis of the health cost of the Sturgis motorcycle rally, and it was in the billions of dollars. They've looked at the counties where there were a large number of participants, and the rate of new COVID infection went up about 10% in the counties where people had come back from that rally. So we just don't need to do things like that, have large gatherings of people without masks. We need a uniform message: wear masks and social distance, period.